So now, to show you in practice what it looks like in action, I'm delighted to hand over to our next speaker and partner. My Brain Health is not just leveraging poor infrastructure and following the ethical blueprint. They're reshaping how ethical, inclusive AI can directly drive an impact at scale. Greg, thank you very much. I'm passing over to you.
Hi. Well, thank you. Thanks, Svetlana. It's wonderful to be here, and amazing work. So can you see I need to share my screen. Can you see it? No, not yet. Let me share. I will share my whole screen so you can see it. Okay, can you see it now?
Greg, we can see it now. You need to put it into presentation mode.
Cool.
Earlier on, I did tell the audience that there is a Q&A availability, which we've just switched on. You may not have seen it. Hopefully you can see it now. Any questions, please add it to the Q&A, and that's to the audience. And we'll address the questions at the end. Thank you. So over to you, Greg. Thank you very much for joining us. Maybe a quick introduction. Greg is CEO of My Brain Health in North Carolina, but is also a researcher at the Center for Healthy Brain Aging at King's College London. So we look forward to your presentation. Thank you, Greg.
Thanks, Richard. Hi, everyone. So, the amazing work that Svetlana talked about, right? It's the foundation of what we need to scale care that matters to people and that produces the high value outcomes that we all desire, deserve. And what I'm going to focus on today is how we've done in the past to build an about me care model that asks patients what matters to them and delivers care that matters to them, and then measures whether or not, across a population, if we are actually at scale delivering care that matters to people. And so I'm going to walk you through a project that we've been doing over the past several years, both in the US and globally, and then how, just briefly, we've started to work with the poor and the amazing team there and Svetlana's leadership. But really a call to action to see if we can invite people globally to work with us to take the opportunity we have through AI and through people like the Apora team and what they've built to scale care that matters to people around the world. Now, I will say that I'm going to talk a little bit about the care model that we built broadly for around the About Me, but what the focus for the future is on brain health. And so as we move forward to building out the next layer of the vision, we are centered on brain health and enabling people to live their best life while they age. And so that is our mission. So our mission moving forward is to ensure that every adult around the world with cognitive decline can experience the About Me care that they need to live their best life. And so as we think about this conversation that we're having right now, it's truly centered on the principle of, are we doing everything in the way we think? Are we doing everything we can to enable About Me care for adults around the world? And so we're going to talk about that and hopefully inspire you a little bit with the background and what we've done thus far that can show the potential of where we're leading. So the principle of what we're doing and the way we think about every conversation around design and the products that we build, or our building, the research that we do is, really rest on these three statements, right? What we say matters, when we say it, how we say it, it all matters. And we need to do what we can to invite people to share what matters to them, their values, their preferences, their goals, understanding their circumstances. And so that we can say, talk about what matters to them, provide timely care. So when we say it, when we do what we need to do to help people live their best life, that matters. And of course, always speak respectfully, culturally aware, et cetera, so that people feel like they are human and that we can deliver human-centered care, again, in a way that matters, that produces results that matters to people. And so this About Me model and those principles that we talked about, we've been doing it for 7-8 years now, and we're moving, as I mentioned, into brain health. But it's incredible, right? As you all, I'm sure many of you have done this, when you start to engage people in care and conversations that elicit who they are, not just as a patient but as a human, you can both change the way that change outcomes and the way that people experience care. You have clinicians through this work saying, for the first time I feel part of my patient's team. We have patients saying, I've never had care for this in my life, for my health and needs like this before my life. We've been doing work not just within patients, but really taking this approach to engage people in communities who are typically underserved. Mayors saying, look, you're doing things the right way. Thank you for caring for my people. And clinicians, going back to clinicians, really bringing care and the care model back to why they wanted to be doctors in the first place. And so truly centering care again on what matters to people and enabling that to happen, that conversation about what matters to people between a clinician and a patient. That's what we're striving for. That's what we've been doing. So this is not just based off of something that, as we look forward about how we can build this out and scale, this is work. I mentioned for me personally, been doing it for 7 or 8 years, and these outcomes I've been sharing have been within that particular journey. But of course, this has been decades on, and really what we're building on when we talk about me are 30, 40 years. Sorry if I'm shorting anyone else who started before then, around how do we ask questions that matter to people and how do we integrate patient voice into care through things like the clinical value compass, things like shared decision-making, principles of whole person care, co-production, what matters index, all these things. And for me, fortunately, I've been able to work with people who have been leaders in this space through my time when I was at the Dartmouth Institute in the US or doing work with Karolinska in Sweden or wherever, many places around the world. But it's the foundation that we're building on. And now with AI and the work that Svetlana and team are doing, for example, is we have this opportunity, we think, to scale it and to build these reliable systems that can truly engage people in care that matters to them. But let's just talk a little bit about why this About Me concept sort of inspired us. We know that conversations and tools that engage people in what matters to them are important. But the one thing that really frustrated me when we started this about 7 years ago is we have brilliant minds creating instruments, validated instruments. They're asking patients these various questions, and they're implementing at policy level and a state level. And as I was out there working with patients directly and asking them what matters to them, or in communities, particularly people who are underserved or maybe don't have less education, they're being asked to ask questions like, like the first two there. Within the past 2 months, did you worry about what food would run out? And you have this next question that seems to be exactly the same. There are these long-winded questions that patients, one, they feel like they're just part of a medical system. It's not a human system. And they're just being asked to do surveys that aren't even incorporated into care. And they just get frustrated and they ignore it and they just like, whatever. And so we said, well, how can we, if we truly have this goal of creating human-centered care and care that creates a relationship between a provider and a patient, do we need long-winded questions? How do we make this as simple as possible, as joyful, as colorful, so that people in the care system and patients really feel like they're part of this conversation? So what we did is said, let's simplify it. And we created an index card, and that just said, just tell us what's up. How are you feeling? Do you have any goal? What are your goals for the visit day? We don't need long-winded questions. And again, maybe there's ways to improve this, but this was the first version 7-8 years ago, is we would hand this card to a patient when they came into the clinic. Paper card, we made it all different colors, so they didn't feel like just a white piece of paper that patients already had. So we had these, all these fun colors, and just said, check it off. And you're going to take it back, or sometimes the clinic staff would take it back to the doctor. They would review it before the visit. And they would use this to start the conversation. Tell me why within the past 12 months, you have these concerns. And immediately they're creating this human conversation. But what we did, and this is essentially synthesizing and making it simple to create a conversation. But what we also did is we asked questions on the back of the card. And we asked questions about confidence. And we know that over the years, confidence has been a key driver of health and health outcomes, and how it's particularly tied to people of lower socioeconomic status and et cetera. And so we use that data to say, well, if you have these concerns and we need to think about what to prioritize, let's make sure we understand someone's ability to confidently move forward in addressing that. So we, again, inspiring questions, inspiring conversation. We're not trying to get a biography of someone through a long-winded instrument. It's truly just to inspire conversations. We also, quote unquote, stole a question from Mayo and the palliative team, where they ask, for clinicians, would you be surprised this patient would die the next 18 months? And we stole that and changed it to, would you be surprised if you were admitted to the ED or hospital in the next 30 days? And again, patients, when you ask them, they tell you what matters to them. They tell you their concerns. It's just simply asking them. And we've, again, through all this data that we've collected, we've validated that patients, essentially, if they're going, there's a high proportion of patients that tell you they're going to go to the hospital that actually go to the hospital. And then we ask patients, how do you want to learn? How do you want us to communicate with you? And then at the bottom, we said, well, let's humanize this. Even if a provider doesn't have time at that particular moment to respond to all of these questions, what if we humanized it? And so we said, hey, why don't we ask patients to draw or write something that matters to them? So again, it's not just about the person as a disease, it's the person as a human, and we can humanize that. And so patients, when we tested this, would say, we get it. They didn't even have to fill out the card. They just looked at it and they said, we get it. You now want to think about who we are, not just medications. And then clinicians were like, oh, you know what, maybe I'll try it, but patients aren't going to fill this out. You know what, it's just, I don't know, I'm too busy. Do we really need to do this? And it's the whole change process that many of you have probably gone through is super hard when you're trying to introduce something new. Well, nonetheless, patients, we have thousands of drawings from patients. And in fact, that was, they completed the card, they enjoyed completing the card, they liked being able to talk about what mattered to them. They drew pictures from, things you can see on the screen, like I'm afraid I'm going to go to the ER, or I like Christmas, I like my grandchildren, I like ice cream, I want money, just superhuman, I love fishing, whatever, superhuman things. I like to lift weights, whatever. And you can see down here at the bottom, I like a hot fudge sundae or whatever, banana split. And this invited conversation. Then one of the things that a CEO said is that, I would love all of my clinicians to say at the beginning of a visit, you know what, I love ice cream too. Or, how's your fishing been? Something to humanize care. And this enables that to happen. And just in a fun way through a drawing. And so patients would also write things on their card like, you know what, I'm worried about accidentally eating something that is unhealthy, and things like that, again, that create this human moment. And again, we have thousands and thousands of comments like that not just enable the clinician that moment to connect with a person as a human, but of course, and we won't go into it now, but we also created these downstream teams to physicians in particular are really focused on the medical needs, and this is meant to generate conversation, but then the downstream teams were going to take care of the social determinants and things but they could use these comments and use the drawings as well to engage people in really human-centered care over time. And so we have over 120,000 cards just at one health system since that time. And you can imagine it took a few years to get really rolling. Because providers, in the sense of resistance to change, which is totally logical, and so we have that. We also led a global project. Once we got to about 100,000 cards, we led a global project with teams in Sweden and Korea and Spain, and we converted that original card that I showed you into an aging card. And this is what inspired me to move into brain health. And so we had people from around the world. And of course, stakeholders from patients to patient stakeholder groups to clinicians say, what do we need to do to engage older adults who have cognitive decline in a conversation like this About Me card? So we created an About Me card specifically for older adults. And, we've already implemented an Epic. It's already being used in Epic. We have more than 10,000 cards now being collected at the point of care to facilitate care conversations for older adults. In fact, one system is using both cards. They're using the original card for anyone under 55. They're using the new card for anyone over 55, and Epic just splits it. And so there's no other determinations. It's that simple of implementation, just from an age point of view. And of course, we're all on this continuum, but they just wanted to make it that simple. And so, again, the goal here is to generate these human-centered conversations that focus on care on about me as a human. And so what we're doing now is we're taking all these lessons and we're taking this work, and with the hope of, or having a hope of scaling it beyond just the system, for example, in the US. And so we're doing two things, and this is my focus in the work with Svetlana and Apora. It's my focus of my PhD study at King's College with Dag Arslan and Dr. Dag Arslan and others. And is that we're building out a digital human and SMS, but really trying to scale human-centered conversations via digital human, which sounds a bit weird, right? But the principle is that this digital human will apply these about me principles of care of conversation to how we have conversations with individuals through a digital human, so that we can scale who we support, we can touch the lives of more people. And it is meant to be a companion to physicians, not to replace physicians, but to truly be a downstream post-diagnostic care companion. So as someone, for example, this is, and where we're working on this right now, is the Brain Health Clinic in the NHS, is that as those diagnosis happens, that information will come to the digital human. The digital human will talk to the patient about them like a telehealth visit. So think about a telehealth visit. And it will only talk about, brain health knowledge content that is approved. It only talk about what's already been diagnosed for the patient. There's no diagnosis. It's simply, do you understand what's happening in your brain as you age? Do you want to talk about the options you have to address your concerns? Do you want to talk about, over time, how whatever action you've decided to take, or we've helped you decide to take, how that's working for you and what other options you might have in your life? And so it's meant to be this post-diagnostic care companion that can, one, help you make decisions, and then over time support you along your journey, and as needed, of course, ingest new information from the clinician, from future visits with the clinician, but just be there and be in connection with the patient, and of course in coordination with the provider and whatever is being decided between the patient and the provider. And so this idea, though, the foundation is really some of the things that Svetlana pointed out. It's making sure that whatever we do in the conversation we have, we approach it ethically, and that we have a model in the back end that can always make sure the about me care is delivered in an ethical way. And so the work we're doing right now with the Brain Health Clinic is really this feasibility study, and studying whether or not the digital human can work, and will patients like it, and so on. But this idea that we're talking to you all about today is really the larger framework that's needed to make sure that these conversations are reliable, trusted, et cetera. And so the way we think about building out this framework to support it is we want to make sure that there is, of course, and we could think of other ways of phrasing this, but we have accurate, complete, clear conversations that support the patient and clinician during their conversation. So if we want to, for example, not just provide the post-diagnostic support, but if a clinician and a patient are having a conversation, how can we make sure the information that we give them is based off, is evidence-based, patient preferences, goals, circumstances, so that those conversations and those co-production discussions are accurate, complete, clear, based off, again, the combination of evidence-based care and patient preferences. And the reason why we want to make sure this happens, and we're thinking about this ethical framework, and Svetlana pointed this out a little bit, but when you see a lot of the research that's been going on and making sure that, as, for example, ambient technologies, that large language models are responding via evidence-based care, and they're being tested against all these evidence-based models and guidelines, et cetera. What we're thinking about with this ethical framework is building a project to make sure that it's not just evidence-based, but we're building an ethical framework to make sure that it's evidence-based and that we have accuracy, completeness, clarity around what matters to the patient. And so the AI has an opportunity, we think, both in the at the point of visit, and the next slide I'll show is in between when patients are having these digital human patient conversations, is that every conversation that is supported by AI has this about me ethical framework to support and make sure that there is evidence-based care in combination with what always we know. Are we asking patient what matters to them? Are we delivering what matters to them? And to be able to validate that. And so that's what this ethical framework that we're thinking about building, and would invite others to support, to make sure is there, and that we can prove out at scale that large language models can always make sure that we're delivering care that matters to people, both evidence-based and based off their preferences and goals and circumstances and values, et cetera. And so again, it's not just can a large language model support at the point of care, but for us, for the post-diagnostic support work that we're doing, it's the same thing. Or is every conversation evidence-based? Is every conversation based on patient preferences? And are those conversations timely, accessible? Are they safe? So all these principles that we want to make sure are delivered for every patient and every conversation supported by a large language model. And that's essentially the ethical framework that we want to build out. And then, of course, when we're evaluating outcomes, it's the same thing. We're evaluating whether or not every conversation with a human that's facilitated by AI, is there alignment with patient goals? Is there alignment with patient preferences? Is there alignment with evidence-based care? Did we find any variation in that? And what is the impact? Are these conversations leading to results that matter to people and improving their lives? And so this is just meant to be sort of a very high level of what we're thinking about, and that this framework, if we can build it, with brilliant minds like you all and others from around the world, to make sure that we're building this ethical framework and allowing really any AI facilitated any tool that's AI facilitated for care conversations with individuals, is it always leading to, again, that combination, not just is it validated against guidelines, but is it validated against guidelines and patient preferences? So things like the About Me profile, trust and safety, things like that. And so it could feed and support point of care discussions, post-diagnostic discussions, and evaluation to say, yes, we are delivering care now at scale, like we've been talking about for seemingly a long time in the human context, that we always need to deliver, we always want to and always have aimed to deliver human-centered care. And we think that building a framework like this to enable large language models to deliver confidently care around the About Me model that is that truly focuses on people can give us a chance to scale the human-centered care that we've desired for a long time. So next steps for us is we hope to launch a council, get people engaged, figure out also where and how we can recruit participants, co-produce the framework, and test it out, and release something as an open source model where people can use it and make it better to support how large language models can deliver About Me care through the AI ethical framework that we've just talked about. Richard, over to you.
Greg, thank you very much for your presentation.